Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho.
Coming up, why do we eat that brownie, that piece of pizza, or that hamburger, even if we know it's going to make us pack on the pounds? My guest today says the food industry is more than partly to blame. I talk with Dr. David Kessler, the former head of the Food and Drug Administration, next on Dialogue. Stay tuned. Hello and welcome to Dialogue. I'm Marcia Franklin. Americans are fat. According to the Centers for Disease Control and Prevention, more than 30% of the adults in the United States and nearly 20% of the country's children are obese. That's 90 million people. Add to that those who are overweight but not yet obese, and the number is much higher. It's a public health crisis that my guest today says cannot be ignored, and which he believes has its roots in the way food is now made and made available. Dr. David Kessler was the Commissioner of the Food and Drug Administration, or FDA, from 1990 to 1997 under Presidents George H.W. Bush and Bill Clinton. Best known for his efforts to regulate tobacco products, Dr. Kessler chronicled that battle in A Question of Intent, a book that's been described as a, quote, policy thriller. For the past decade, he's set his sights on another public health challenge, what's been termed an epidemic of obesity in America. In his latest book, The End of Overeating, Dr. Kessler lays out his thesis that a potent and intentionally developed combination of sugar, fat, and salt in some foods has made them so irresistible that our brains have literally been rewired to crave them. In the book, he offers strategies for resisting those urges and touches on some public policy changes he believes are needed to combat obesity and its collateral damage. And Dr. Kessler is in our studio today to talk about those and other issues. Welcome.
Thank you for having me.
And now Dr. Kessler is in Boise to speak at St. Alphonsus Regional Medical Center, and we thank the organizers of his talk for finding time in his schedule for this interview. First of all, Dr. Kessler, when you wrote A Question of Intent, which, as I said, was about your struggle to have the FDA regulate tobacco products, you said you had to write that book. You just really had to write it. Did you feel the same for this book, The End of Overeating, this compulsion that you had to write it?
It's very interesting the way you put the question, this need, this drive. I was very interested in why that chocolate chip cookie has such power over me. You know, things are rarely linear in life. I was sitting in my office. I was dean at Yale Medical School, and I was with a group of residents and fellows. I was asking a very basic question. If you want to stay alive, what are the things you can do? 3/4 of us are going to die of either cancer, cardiovascular disease, or stroke. And I was very interested in what the evidence was on prevention, what really we could do that would make a difference. And one of the librarians at Yale was helping me with the project. So she was pulling all the literature, the medical literature, all the evidence, all the data on about what you can do on prevention of those 3 diseases. And I noticed as she was doing that over a 3-month period, she lost 30 pounds. We all know, the weight's not good for us, excess calories. But the fact is, and we all know that we should diet and exercise. If it was that simple, right, we'd all be doing it. So I was very interested in what was going on with weight.
And as a physician and a public health individual, you felt compelled to write this. You felt a need, that there's an urgency.
I was watching one night the rerun of the Daily Oprah show. And on the set, there was a woman, and I still remember. She said, she was well-educated, sophisticated, well-dressed. And she said, I eat after my husband goes off to work in the morning. I eat before he comes home at night. I eat when I'm happy. I eat when I'm sad. I eat when I'm hungry. I eat when I'm not hungry. And then she looked in the camera in that moment and she said, and I don't like myself. So why was this woman doing what she didn't want to be doing, but she was doing it anyway? And I could relate. I have suits in every size. So what's gone on, over the last 4 decades, with weight? And that was the first question. And if you look at the graphs, when I was growing up as a kid, weight was relatively stable over our adult lifetimes. You entered your 20s, maybe you gained a few pounds between 20 and 40, but weight was relatively flat. And you lost a few pounds in your senior years. Today, you enter your adult years 18 pounds heavier, and you keep on gaining weight into your 50s. But what was driving that woman to do what she didn't want to be doing? That was the question. That was what I spent the last 7 years trying to understand.
In the book, you say, quote, "The food industry has hijacked our brains." What do you mean by that? As I mentioned in the introduction, your research discovered this kind of potent combination of sugar, fat, and salt. Individually, people may not be so seduced by them, but together, they're quite a seduction, aren't they?
I used to think that I was eating for nourishment. I was eating for satisfaction, right? I was eating for fuel. The fact is that fat and sugar, fat and salt, fat, sugar, and salt stimulate us to eat more and more. What did we do in this country? We took fat, sugar, and salt, we layered it and loaded it into our food. We put it on every corner. We made it accessible 24/7. We made it socially acceptable to eat. Walk into any food mall, it's like we're living in a food carnival. What did we think was going to happen?
Is it intentional? You wrote a book and you spent a great deal of your life looking at the intentionality of the tobacco industry in keeping nicotine in the cigarettes, keeping people addicted. Is this an intentional act by the food industry to get us to become addicted to these heavily laden foods?
The food industry figured this out experientially. Right? So they knew the inputs. They knew that fat and sugar, fat and salt, fat, sugar, and salt stimulate. They knew the outputs, that people came back for more. They didn't understand the neuroscience. They didn't understand what was going on in people's brains. But today we have that neuroscience. Let me give you 3 characteristics. A hard time controlling eating. Sort of a loss of control, not a real loss of control because you're conscious and you could stop it, but a feeling like it's hard to control your eating. A lack of satiation, a lack of feeling full, a hard time stopping eating, or a preoccupation, a thinking about foods between meals, or if that pizza box is there and there's only one slice and I'm sitting there with friends and family and I'm thinking, am I going to get that slice? So those 3 characteristics, loss of control in the face of highly palatable foods, lack of satiation, a preoccupation with foods, we studied that. I mean, that was that woman on Oprah. That's what I was hearing as a clinician. And we found that 50% of people who are obese, 30% of people who are overweight, 20% of people who are a healthy weight score very high on those 3 characteristics. So what is that? What's going on in those people's heads? Right? And that's what we spent 7 years studying. And in fact, what we found is that those people, and there are many, millions and millions, in fact, there's 70 million people who, if you extrapolate the data, who score very high on those characteristics. What you see is if you put them in the brain scanner and you just cue them, you just give them the smell of food, you see that their emotional core of their brains, the amygdala, gets activated and stays activated, so almost in a hyper way, compared to people who don't have that need, that hard time controlling their eating. So there's a biological basis for why it's so hard for millions of Americans to control their eating.
So back to the intentionality, do you think now that the food industry knows, we've seen the neuroscience of what these heavily laden sugar, fat, salt combos can do they have a responsibility to dial back on that, or is it an individual responsibility to stop and say, whoa, I'm not going to eat that loaded plate of nachos?
So the fact is, just because my brain is being activated, right, doesn't mean I shouldn't try to protect myself. I mean, the answer to your question is I think we all have responsibilities. as individuals to be able to protect myself. No one's explained to people what's going on inside their heads. I mean, I think people have always sort of inherently knew, that at least for many people, that food calls out. It's hard to resist, but when you show them exactly what's going on, right, the light bulb sort of goes off, and it becomes easier to help control that behavior. I mean, let me explain to you how this works. We're all wired to focus on the most salient stimuli in our environment. If a bear came into this studio right now, you would stop interviewing me and you'd focus on that bear. Right? I mean, the salient stimuli can be different for different people. It could be illegal drugs, it could be sex, it could be gambling.
Popcorn popping.
Right?
The smell of popcorn.
What's the most socially acceptable salient stimuli in our environment? And the way it works is cues capture our attention. Right? So anything that predicts that food or that food reward, it could be the smell, it could be the time of day. Every time I land, in San Francisco airport, when the plane hits the runway, I start thinking about these dumplings. The plane becomes the cue. So there's this cue, this focused attention, this arousal, right? Then I have these thoughts of wanting, this debate in my head. Maybe, I should take a bite. No, not now, not really. It wouldn't be good for me. But then I eat the food. I have this momentary bliss. A couple of minutes later, I go, why did I do that? And every time I get cued again, I strengthen the neural circuits.
Let's take a look at a young lady talking about this very situation in a recent program on public television.
When I confront food that looks great, it's like those movies where you flash and there's one person on your shoulder and the other on one, and the other one's wearing red and the other's wearing like this angel suit, and it's like, don't eat that. And the other shoulder is saying, eat it, it's right there, you want it, it's really good. And then they just start arguing, and you just want to turn them both off and grab the thing, but you have to listen to the angel on your right shoulder.
So that's a young lady that's gone through a weight reduction program and learned to mediate her desires.
And these voices in her head. But what's important is those voices are going off automatically. And the fact is, right, we now have taken these cues, right, and we've put them on every corner. You can't walk more than 10, 15 feet. My guess, even here in the studio, with having some food or food cue, right, stimulating us.
This morning in the coffee shop, I noticed a sign that was trying to get me to buy a mocha cappuccino, I think it was, but it has Oreo cookies in it. It said on the poster, "My mocha moment with a cookie crescendo." But this goes back to my question. I mean, that the food industry knows that, adding these little notes in, a cookie crescendo, they know now what hyperpalatable foods are and what they do. So do they have a responsibility to make less of these foods? Is there a responsibility for the food industry?
Absolutely. I was invited to go talk to one of the largest food companies in the world. And they wanted to understand what was going on. And I gave them the following analogy. But you got to be careful. There's similarities, but there's differences. I said to them, nicotine. Nicotine is a moderately reinforcing chemical. But add to that nicotine the smoke, the throat scratch, the cellophane crinkling of the pack, the image of the cowboy, the sense certainly in my parents' and grandparents' generation that it was sexy, it was glamorous, it was adventuresome to smoke. We took a moderately reinforcing chemical and we made it into a highly addictive product. I give you a package of sugar and say, go have a good time. You'll say, what are you talking about? But add to that sugar, add fat, add temperature, add color, add mouthfeel, add the emotional gloss of advertising. Put it on every corner. Right? So yes, the food industry.
So what should they do? Not make they'll say, well, we're just making what people want.
And in some ways, that's true. So the solution is really to change what we want. I mean, in the end, the industry will change when what we want changes.
So it's different than when you went after the tobacco industry. Then you don't see the malevolence that perhaps you saw within that industry.
Look, I mean, the tobacco industry did a lot of science. They knew that nicotine was addictive and said it privately inside the companies long before they told the American public. And they intentionally deceived the American public. That's not what happened with foods. We all have responsibilities. By 2030, the CDC, the Centers for Disease Control, predicts that a third of Americans will be diabetic. I mean, think about our health care bill today and what that means in 30 years. And the reason I'm so happy to be here in Boise, I mean, St. Alphonsus, the health system, wants to engage the entire community. I mean, the fact is, understand how this works. It's not just the fat, sugar, and salt, right? It's layered and loaded into our food. It's not the fact that it's just on every corner. Right? It's not just my brain. Right? The fact is, it's how we as a society view food. I mean, how did we change tobacco? Right? We didn't change the product.
Stigmatized it.
We demonized it. We really did
really
demonize.
Difficult to stigmatize. You don't want to stigmatize the obese person. Very difficult to stigmatize food, but give people healthy choices, I assume.
That's exactly right. I mean, first of all, if anything, the more I understand the science, the more empathetic I am about people who have a hard time controlling their eating. So this is not about people, who are big. This is about the food.
It's not about willpower necessarily only.
Because it's not willpower, right? I mean, entirely, because our brains are being activated automatically.
What kind of people are the people that, and I've seen them, they just put a teeny little bit on the plate and they don't seem to be seduced by much of anything, sugary foods or pizza or whatever, they take a pass. Do we know the science of these lean people?
Those are the people I want to study.
Yeah, really.
I mean, why for them, food is not a very salient stimuli, right? I mean, but what other things may capture their brain. Understand why food is so powerful. Okay? I mean, where does the power of food come from? I mean, it comes not just from the taste. It comes from the anticipation.
Sure.
It comes
from the memories associated.
Right. So if I said to you, right, what's your favorite food? What's the hardest thing for you to resist?
Cheese.
Right. And I bet right now, right, you can conjure up in your head what it tastes like, right? That memory.
One of the things that I do, though, for foods that I know I shouldn't have, is I make a negative association. So I have become, I'm actually lactose intolerant, so I shouldn't be eating milk products. And I don't drink milk. And I haven't since I was a child, because whenever I see a glass of milk in my mind, I almost become ill. And so I try to do that as much as possible, make a negative association with a food that I know is not good for me. Or I think, as you said before, how will I feel 10 minutes after I eat this? You know what I mean? Try and recall that unpleasant feeling. And 50-60% of the time it works. But when you're under stress or something like that, you fall.
And so, but you can also predict how this is going, that wanting, right? Not just that liking, but that wanting is going to come into your head. My guess is there are certain places and certain times that those cues, right, become more powerful. Yeah. And you can predict those, because once those cues activate your brain, right, once that arousal, that increased attention, once you're into that inner dialogue, boy, that would be good. No, not now. It's very hard to stop. So
and I like things like kale and beets and veggies and stuff like that. But when you're in that kind of moment, sometimes you just don't want a kale salad. We're running out of time rapidly. I just want to ask you, one of the things I found fascinating in your book was you go into some detail about how food, especially in restaurants, is kind of pre-masticated for us. It's like adult baby food. It's been pounded and it's been marinade has been drilled into it. And actually reading your book, and remembering some of the paragraphs in it, just like watching some movies about some aspects of the food industry, can now make me think, well, I don't know if I really want to eat that.
So pick any appetizer.
But it's like an adult baby food.
Absolutely. Pick any appetizer in a modern American restaurant. Pick buffalo wings.
Those I can resist.
But what's in those, right? So you take the fatty part of the chicken, right? You load in the manufacturing plant, 30%, you push fat into it, you push the water out. Fried again in the kitchen at the restaurant. That red sauce, what is it? It's fat and sugar. That white creamy sauce, fat and salt. What are we eating? Fat on fat on fat on fat, sugar, and salt. Back in the 1920s and 30s, in order to feed a hungry nation, right, the food industry learned to process food. A lot of advantages: increased shelf life, cheaper foods, increased food safety. Along the way, the food industry learned to dial in fat, sugar, and salt, and it learned to take out anything that was objectionable in the food. 20, 30 years ago, every bite I would chew maybe 20, 30 times. Today, it's food, they've taken everything out of the food that's objectionable. It goes down in a wash. I'm just self-stimulating myself.
And then you don't realize that you're full as early as you might have if you chewed more.
Well, because I'm being stimulated, my amygdala is being activated, the emotional core, I'm in this zoned out state, right, where this momentary bliss, and it's only a couple minutes later that I go, why did I do that?
What I also found really interesting in your book is you worked very hard as FDA commissioner to get what we now think of as maybe pro forma nutritional labeling on foods in the store. You know, people pick up a package and it's ubiquitous. People turn it around and look at what's on the label. It's not so in restaurants, and I think one of the things that you would like to see, and some restaurants and fast food places have started, put it on the menu, the calorie count, the fat grams, etc. The restaurant industry has kind of slid around all of that, hasn't it?
I sort of got outed because I went dumpster diving in order to really find out what was in restaurant foods. Look, there's a wide debate on what the legitimate public policy roles of government is. I think the one thing we can agree on, right, is disclosure of what's in our food and education of our children are legitimate roles. And I think people who want to use that information, right, should be able to have it. But understand, this isn't just about information. This is about the emotional core of my brain. Most of us know, right, what we should do.
Yeah.
Right? The issue is, why don't we do it? And the fact is that food is much more powerful than we recognize.
These new combinations of food. What do you think, speaking of going back to public policy issues, what do you think of New York City's proposal to put a limit on the size of some things like sodas?
So I think, Mayor Bloomberg is right that if you look at what's really driving this epidemic, right, the fact is big portion sizes, right, are one of the things that are driving this epidemic. So I think the focus is right. I think the debate, right, is whether banning it is the right way. But changing how we as a society view those portion sizes. I look at these huge portion sizes. I used to look and think, boy, that's great. I mean, that's a lot of value. Now I look at it and I say, oh, do I really want that?
So I didn't hear whether you support it or not.
I think he's focused on the right issues, right? I would love us to be able to change the social norm and us all to change how we see that. Whether government bans it, I think people can have individual views on that.
And what about, do you feel similarly about taxing, putting additional taxes on things like soda pop and fast food?
Yeah. I think in the end, what I learned with tobacco, right, was things like taxes, where one could smoke. Those were tools along the way. In the end, what did we do? We changed how we as a country view cigarettes. We used to view it as our friend. Now we view it for what it is. Food, you're right. You can't change, how food has to be pleasurable, right? Because if you, demonize food, I mean, that's the stuff of the eating disorders. You don't want to go there. But I think big portions, highly processed foods. I mean, the fact is, we had this epidemic licked back in the 1950s and 1960s. When did we eat? We used to eat at meals. When do we eat today? We eat all the time.
Well, now they tell you to eat like 5 different meals a day, that it's better for your body to be eating these little meals all the way through the day.
But the fact is, Now we're not just eating little meals throughout the day. We're eating these huge meals, and those huge meals are loaded with fat and salt, fat and sugar and salt.
Are you pleased that the Disney Corporation is going to be, in a couple years, not accepting advertising for certain foods?
Yeah, I think we're all starting to do our part. There's now downtown Boise, Mondays, Meet Me Mondays. Late in the day, community walk, people coming together, walking into hospital cafeterias. Food is getting better, more healthy. We all have our part to do. And bringing together the community, I mean, that's why I'm here, and that's what the St. Alphonsus system is doing.
I wonder, sometimes the substitutions for these things, though, the sugar substitutions, the fat substitutions, can be almost worse, create more problems.
Food has to be pleasurable. And the fact is, the more we realize, right, that it's really not that hard. The real solution is to eat real wholesome foods and not...
So have some sugar a little bit, have some salt a little bit. Not all locked and loaded on top of each other in large portions.
And don't do it constantly throughout the day.
What's next for you, Doctor? What's your next project?
I'm working on a book on emotional distress, emotional suffering. Very interested in understanding, having done tobacco, having done overeating, how the mechanisms associated with addiction, how they may apply to our thoughts, our obsessions, our phobias, our depressions. Really, what does it mean to be a human being?
Researching that must be fascinating, talking to the subjects.
Oh, absolutely. I mean, it's at the core of being.
Is it anxiety producing in and of itself, working on the book?
No, and I will tell you, being here with you is wonderful. It's great.
All right. Well, thank you so much for taking the time. I know you have a busy schedule coming up, so I appreciate you dropping by the studio. You've been listening to Dr. David Kessler, the former Commissioner of the Food and Drug Administration. We'll continue our conversation in a web extra, which you can find on our website at idahoptv.org. Just click on Dialogue. And remember to check out our Facebook page. I'm Marcia Franklin. Thanks for tuning in.
Presentation of Dialogue on Idaho Public Television is made possible through the generous support of the Laura Moore Cunningham Foundation, committed to fulfilling the Moore family's legacy of building the great state of Idaho. Check out our website, become a friend on Facebook, or follow us on Twitter.